Hi, I'm Dr. Sidney Barnes, Chief of Surgery at Lewis Gale Allegheny. We have all suffered the consequences of COVID-19. Many patients voice their concerns and anxieties about whether it's safe to come to the hospital. And as such, Lewis Gale, in conjunction with HCA, our parent company, the American College of Surgeons, and other major institutions throughout the country, have developed a roadmap for us to safely get you and your loved ones through healthcare, whether that's elective surgery or emergent surgery. The purpose of this video is to answer any questions you might have and to show you that we've always had the concern to get you through this process safely. So let's go and see what the process is. Our screening process actually starts before you come to the hospital. You'll be receiving a phone call that'll ask you some basic questions about your health, your travel history, as well as that of your family members. Once those questions have been answered, the next step would be actually coming to the hospital. Every employee, doctors, nurses, and staff, administration, all get screened through this entrance every day. We're trying to make sure that we're all healthy to keep you healthy. Every employee that comes through here will have the mask and will be greeted and ask some questions and tested for our temperature.
Let's start by taking your temperature.
On the day of surgery, a volunteer will take you on the elevator up to the second floor where you will walk to the surgical waiting room. If you don't have masks, don't worry, we will provide masks for you. And as we're going to show you in the surgical waiting room, we're aware of social distancing as well. You'll see that all the chairs here are separated, and there is a limitation to only one visitor per patient. Okay, we're going to head back to the operating room right now. Prior to surgery, you will be contacted by pre-admission testing. We test every patient going to surgery at those procedures which are considered high risk for COVID. We ask that after you're tested for COVID and test negative, that you quarantine yourself a couple days before surgery. And as you see here, this is one of the surgical pods where you are preoperatively. And again, paying very close attention to, these are individual rooms that are cleaned in between every patient, and it allows the patient and their visitor to be isolated while they're awaiting surgery. So this is one of our typical operating rooms. In between every patient, it is sterilely cleaned down, and then at the end of the day, it's given what's called a terminal cleansing. We certainly hope that this video clip makes you feel a little bit more comfortable about the whole process, from coming into the hospital to the preoperative area and finally going back to the operating room. We take due diligence and pride in keeping our patients and caring for them safely and compassionately. And if you have any further questions at all, please call the hospital or call my office and we'll try to answer those questions for you. We look forward to taking care of you and your loved ones.